so much. Well, good morning, everyone. It's such a pleasure to see you for so many reasons. First, I want to thank David, you and George, you for your leadership in helping to develop and bring together to convene this first meeting of the Roundtable and the Forum for Population Health. And it's great to see so many kindred spirits sitting in the room, people whom I've known in different capacities over time here at the Institute of Medicine and before, and people I admire so much and know that you are so deeply engaged and committed to the same objective of population health. We are a small but hearty band, and it is a critical need for those who share the values and the aspirations for population health to be able to come together in many different venues, in many different ways, to be able to work in concert toward the objective that we share. I would begin by just re-emphasizing what must be obvious to all of you because you are here, that you've adopted the right perspective by coming together around this question of the health of populations. There is no question in my mind that if we care about the well-being of society and the health of every individual, that the right way to think about it, to act to achieve it, to conceptualize and to carry out our programs is always with the question in mind, what difference will this make for the health of the population? And the essential point of having a population perspective is that you interpret every potential action, every potential program, every potential intervention in terms of what it ultimately means to the health of people in a community and in our society. When you start with a challenge that grand and complicated and difficult, you have to ask yourself, how do we get into the question in a constructive and productive way? And one of the tasks, I think, that will be before this forum as it proceeds is to figure out what are the avenues for effecting improvement in population health that are within our reach. Not what is just available hypothetically or theoretically, but what is it that can be done that would be actually achievable by us. And I think the task before a group that's taken up that kind of a question is not a short-term task, it's a long-term task. It's not something that if you embark on it, you can expect it will be done in a year or 2 years or 3 years. It is not something that we'll be able to achieve, I believe, simply by adopting a single pointed strategy that will somehow transform our current state of health and well-being into a healthier state. It is not a task that will be accomplished by working isolatedly and individually, but one that is going to require mobilization and collective action from many quarters. And so part of the task that I think the forum has is how do we describe and explain the objective? How do we conceive of the tools and the strategies? And then how do we mobilize the necessary partners to work together to achieve healthier populations? Those are really very profound questions. And I would say, I would hope that the forum will be able to tackle some questions that will have some near-term effects and benefits, proof of concept, as well as not lose sight of those that will have longer term requirements in order to manifest ultimately, hopefully, more important and significant benefits for the health of the population. Now, each of us, when we come to this question, come to it necessarily from our own backgrounds and experiences. If we are trained in medicine or nursing or business or public policy or sociology or economics or education, whatever our particular orientation has been, that's the tool set, the perspective that we bring when we think about a question like population health. And so one of the first demands for success, I would say, is to be able simultaneously to bring the perspectives that we each have, to be able to share them with others, and most importantly, to be able to apprehend and appreciate the perspectives that others can bring to the question. Now, I say this premised on a belief that these goals of population health are so demanding, multifaceted, and complicated that we cannot succeed unless we're prepared to take advantage of every perspective, skill set, way of thinking, strategy that emerges from looking at the problem from different perspectives. And so I hope an operating principle that the forum will champion is a principle of mutual respect, exchange, and exploitation, in which we work hard to take fullest advantage of the experiences and perspectives that others can bring to the problem. Now, this demands a very critical attitude about challenging, willingness to challenge one another, willingness to defend and explain, willingness to have the kind of open debates about what works and what will not work and why, but to do it in an atmosphere that is grounded in a sense of mutual appreciation and respect. And that is, I think, going to be a critical determinant of whether this workshop can do more, this forum can accomplish more over time than what has been already done by many actors in many different venues, working in the ways that many of you here and I and others have already been. What is the value added that we can bring by working together in this venue? How can we take fullest advantage of one another, the resources that we each can mobilize, and also, if I may say, the resources represented by the Institute of Medicine and the National Academies? What difference does it make if we're doing this here than if we were doing it somewhere else, at a university, or in a community health center, or at an academic health center? And I would submit that one of the advantages we have is that this is a place that legitimates the contribution of every different field of science and of understanding. And this is a place that is situated at the intersection of the world of the academy and the world of policy and action, at least at the federal level. This is a place that, while its tradition and its grounding is on developing and using evidence and science to give advice, is increasingly aware, and this is a good manifestation of the importance of taking action as well as giving advice. And so I'm also hopeful that this forum, working together, will not only develop ideas for what the nation must do, but will also be very concrete about what can we do collectively through the forum, and what can we do taking fullest advantage of the resource represented by the Academies and the Institute of Medicine to advance the cause of population health. Now, my own perspective on population health is that I believe fundamentally, over time, that what we really have to achieve is what I think of as a culture of health, which is more than just a program, more than just a targeted resource reallocation, more than just a change in a particular individual behavior, no matter how important that may be for health around tobacco or use of alcohol or unsafe driving or any of the other individual behaviors. I believe what we are really driving toward, should be driving toward, is a change in our culture that elevates health to a level of expectation and everyday living so that we no longer need to even be thinking about it. What is culture change is when it is so deeply embedded in our way of doing, our way of living, our way of acting, our way of relating, that we don't have to make conscious choices all the time to be doing it. It's a culture where you don't have to think about the safer streets or the construction of buildings or the establishment of environments which promote health because they're already there. It's a culture where, just as today, at one time in the United States, we had to worry about where to place the spittoons. But today we don't have to think about where to place spittoons. We don't have public spitting. Nobody would be thinking about public spitting. We are in a transition with smoking. I dare say for anyone in this room, if you have a visitor to your home, it would be probably hard to find the ashtrays. And many of us going, even if we're still smoking, to visit friends either would ask or just naturally excuse ourselves and go outside if we're still addicted to tobacco and have to have a smoke. We are in a transition, a cultural transition. The other day I was driving along the highway and someone threw a tissue out of a car. And I was astonished. We don't see public littering on the highways today the way, if you're old enough, and I'm old enough. As a child, I was not only a witness, a contributor to public littering on the highways. And these changes, while they seem individually perhaps superficial, perhaps insignificant, collectively they represent steps toward a more profound transformation, toward a culture of health. And I think that in the longer term, that means mobilizing every resource that we can to reinforce and lead. You cannot move too far ahead of where people's attitudes and beliefs are, but you also cannot afford to stay only where those attitudes and beliefs are at this moment. Entertainment media will matter. Government policy and action will matter at every level. Education will matter at every level. Institutional policy and practice will matter at every level. How our healthcare system evolves will matter at every level. Will we be able to introduce the constructs of community health and embed them in the daily practice of healthcare? Technology will matter. I hope, David, at some point you'll be able to share the story of Asmapolis, because this is a grand example out of a graduate of the Health and Society Scholars Program, where technology has made and is making a real difference. In a nutshell, I'll anticipate the story. A device which uses a combination of an inhaler and GPS detection that can report not only the individual's use of the inhaler, someone who has asthma, and therefore be able to track when an individual may be getting into clinical need of intervention to keep that individual out of hospital, but the capacity to not only monitor longitudinally individual use, but simultaneously the geographic disposition of uses, can tell public health authorities where there may be particular problems that are inducing allergic and asthmatic reaction. And so technology can play a part, making it cheaper, easier, simpler, more possible for people to do the right thing for their health collectively to add up to population health. Individualized medicine. Often we talk about the profound implications over time of more detailed information and knowledge about the treatment and prognosis of illness. But those implications are equally, if not even more profound, around the potential for informing around risk and altering choices and lifestyle of individuals. And there are many challenging questions in this. I hope that as a forum, we can keep very open to realistic solutions, and also to be able to think about who is your foe and who is your friend at different times, not in a way that is necessarily permanent. I will give you a very difficult example that I think is pretty telling. Most of us think if there's any industry that is intrinsically inimical to health, is there any that come to mind? Tobacco, right? What other product is lethal when used as intended, legally available? Right? Tobacco is pretty inimical. Now, what is the business of tobacco companies? If you think it's to sell tobacco, well, that's a means. The business is to make money, and the means is through tobacco. Now the companies have developed alternative nicotine delivery systems that do not involve tobacco, but involve the addictive component of the tobacco experience. Now, question for public health. Are those good or are those bad? It's not an easy question. But what I would like to submit is that I hope we don't try to answer such questions simply by reacting that it must be bad because it comes from tobacco companies. If the answer is that it leads people back into prolonged dependence, tobacco use, and ill health, then it's surely bad. If it's a mechanism to lead people away from the harmful effects of tobacco, from a health point of view, it may be advantageous, especially for the 20% still smoking who are smoking on average more than in the past, on average, because they're the hardcore, most addicted smokers. So if you have an end game strategy for tobacco in the United States, as well as in the world, you may need a different strategy for the last group that are the most addicted than you needed for the group that was more able to abandon or avoid tobacco in the first place. Now, that's not a final answer, it's a question. My urging isn't to adopt an answer prematurely, it's to keep an open mind. to keep an open mind, because if we're going to succeed with a culture change for population health, I believe it is more likely to be hastened insofar as we can mobilize more and more of the critical institutions of society to align themselves with a culture of health. And that includes the business community and our daily lives spent in the workplace, as well as the other institutions that we talked about, from schools to healthcare to government and more. So I hope as you embark on this work that you will think simultaneously about those things that government needs to do, those things that the health system needs to accomplish, both in its avoidance of waste and redeployment, as Steve so eloquently was describing, and in the ways affirmatively, particularly the interface of population health and individual health, can be more fully realized in the healthcare system. I hope that you'll be thinking about the ways in which individually and working together, we in this forum can achieve more for population health, doing the things that are under our control in our respective places and capacities. And most particularly, I hope that you will keep in mind the human and institutional resources of the Institute of Medicine as not just a venue for meeting, but as a resource that can also be mobilized toward this goal. If you look back at the founding charter of the Institute, its purpose is to improve health. It was intended to do this through offering the best of science and evidence, but the goal wasn't the evidence alone. The goal is improving the health, and that is the health of populations. So I'm just thrilled, and I can say to you, George and David, that you have managed to mobilize us to this point and to bring us at the inauguration of an effort that I will be very eager to both participate and to witness as you proceed, and wishing you and all who are part of the forum every success. So thank you all very much for being here, and thank you. Sure.